Good afternoon, everyone. My name is Natasha Trehan. I am 19 years old from Toronto, Canada. I am currently attending the University of Ottawa as a second year student in the biomedical science program in the French immersion stream with the goal of pursuing a career in the healthcare field. Today, I will be talking to you about my journey to advocacy, navigating you through the timeline of my life and how I've grown as a person, as well as what I've learned along the way. What is advocacy? Advocacy to me means taking the initiative to communicate your needs and wants to others in order to support your overall well being. My self advocacy journey started in high school. I was diagnosed with juvenile idiopathic arthritis, also known as JIA, at the age of 13. The thing about invisible disabilities is that after a while, you start to feel invisible too. It's hard for you to speak up, and when you try, you're constantly dismissed. This happened to me in high school. I spent several hours a week in meetings with the administration and the school board authorities to talk about accommodations. I was unable to write and draw due to the extreme inflammation and damage in my fingers and wrists. Writing notes, drawing diagrams, documenting my work and processes for math and science problems became a very big challenge. I often felt judged and dismissed by teachers for not looking sick enough. When I needed extra time and had an individual education plan in place, the test paper was taken away from me because they couldn't see the arthritis in my hands. There were several instances when I was discouraged by some of my teachers and peers to pursue science and math courses. They emphasized that my inability to draw and write would hinder me in excelling in these subjects. They also suggested that I think of an alternative pathway or take an extra year in high school. I was determined not to lose hope, and so I approached the special education department to find a solution in order to actively participate in school. I met multiple times with the technology group from the school board to find a device that would assist me. I tried so many devices on a trial and error basis. I requested for a scribe through the special education department, and every day was a new struggle. It was not easy to dictate science and math to a scribe who had no background knowledge in these subjects. And I still struggle to this day, but I continue to be motivated. I constantly believe in myself and hope to one day be able to achieve all of my dreams. Luckily, I met a special education teacher who believed in me and supported me every step of the way. She fought for me with every teacher and instilled confidence in me to advocate for myself. Not only that, my grade 9 math teacher also supported me and helped me by scribing for me. Those two teachers helped me understand what advocacy was and how speaking up for my needs can be extremely beneficial. My experience made me realize that there are so many young adults and youth in similar situations as me who may not be fortunate to have these members of faculty that will stand up for them. I was determined to advocate for them and also empower them by sharing my story and standing up for the rights of young people with disabilities. My advocacy skills did not end in the school setting. Prior to being sedated before my joint injections in 2019, a woman came to me to talk about how she needed my consent to take my blood and saliva samples. She asked me to fill out a questionnaire and then said that all of this information would be going into a bank for research, including my samples. I was fascinated and intrigued by what they would actually be doing with my samples. Even though I was in pain after the 10 joint injections, I asked for her contact information and then connected with her afterwards to see how I could get involved. During the pandemic, I decided to dedicate my summer to get involved with research so I could truly learn about my own condition and be an advocate for others in similar situations by becoming a patient partner. I developed a passion for research, healthcare, and medicine. I began working alongside researchers here in Ontario in various studies, specifically the I Can Cope app, alongside the Hospital for Sick Children, led by Dr. Jennifer Stinson, which was an app to manage and track chronic pain related symptoms. I was also a patient partner on a UCAN project with Dr. Joseph Cafazzo, which gave me the opportunity to review content for their website pertaining to genomics education for JIA. Later that year, I joined a research team at the Choice Research Lab, led by Dr. Karine Toupin-April, as a member of the Patient Advisory Committee to work on the JIA option map. The JIA option map is a web-based application to help patients and healthcare providers make decisions collaboratively. It really emphasizes the importance of shared decision making. In the beginning of 2021, I was chosen as one out of the 6 candidates to train to become a patient researcher for the Patient and Community Engagement Research Program, PACER, at the University of Calgary. The course taught me how to conduct research, focus groups, do data analysis, and so much more. Our team of 6 patients with JIA researched on other patients with JIA about their transition from pediatric to adult care experience. We recently published our results in the Biomed Central Journal. I joined the COVID-N team with McMaster University's Health Forum. The COVID-N team is a network that brings together more than 50 of the world's leading evidence synthesis technology assessment and guideline development groups around the world. It covers the full spectrum of the pandemic response, from public health measures to economic and social responses. As a citizen partner, I was able to give input as a young person being immunocompromised, but also the perspective of a citizen in Canada. I was a co-investigator for the Youth Engagement and Research Study at the CanChild Center for Childhood Disability Research. The Youth Engagement and Research Study aimed to develop training materials with and for youth with disabilities to support their knowledge, skills, and confidence as research partners. I was able to help in all aspects of the research, from data collection, analysis, to knowledge translation. After these experiences, I felt that even though I was contributing to research within my province, which was correlated to advocacy, I wanted to make a difference nationally. I now sit as a member on the National Advisory Committee Board at Pain Canada and as a member of the Arthritis Patient Advisory Board at Arthritis Research Canada. Pain Canada is the home base for 8 million people in Canada living with chronic pain, and Arthritis Research Canada is the largest clinical arthritis research center in North America. Their overall mission is to transform the lives of people living with arthritis through research and engagement. To further my passion in raising awareness, advocacy, and research, I was a summer research student at the University Health Network in the eHealth Innovation Department in the summer of 2021. I was a part of a research team with members from Canada and the Netherlands that focused on research for juvenile idiopathic arthritis. I worked at the intersection of design, health, and technology, and it really helped mold the features on a patient-facing application. Last summer, I was a summer research student in a research lab at the Hospital for Sick Kids. I was doing data extraction on a study about methotrexate and pharmacogenomics, as well as researching inflammation markers and proteins in kids with inflammatory rheumatic diseases under the supervision of Dr. Ray Young. My involvement in research teams, organizations, and patient engagement in research has really allowed me to become a more resilient and knowledgeable person. I've been able to use my skills, perspective, and knowledge to advocate for other patients and their needs. For the longest time and in the early years of my diagnosis, I felt alone living with my disease. No one understood or recognized the extent of my experiences, and I felt isolated from the rest of my peers. After a couple of years, I found a support group with individuals who suffered disabilities like mine. For the first time in a long time, I didn't feel alone. After conversations with like-minded individuals my age, I launched a podcast called Take a Pain Check in March 2021, interviewing individuals with rheumatic diseases and making it my aim to educate, advocate, and empower. Guest speakers on the podcast range from those living with rheumatic diseases to parents, to friends, researchers, health professionals, and individuals who are making a difference in the rheumatic disease community. I now host bi-weekly podcasts on Sundays at 12 p.m. EST with guests engaging them in conversations about living with a chronic illness, lifestyle initiatives, relationships, accommodations, accomplishments, school, advocacy, struggles they might have faced, and so much more. The Take a Pain Check podcast is a free resource that you can watch on YouTube or listen to on Spotify, Apple Podcasts, Google Podcasts, iHeartRadio, and so many other podcasting platforms. With the feedback that I received from the podcast, from research coordinators, physicians, and patients, I decided to take this to the next level and make Take a Pain Check a nonprofit organization now known as Take a Pain Check Foundation. Researchers and physicians told me that they never really understood the patient perspective because oftentimes patients were too afraid to share about how they were feeling. Parents of young patients mentioned how they loved the podcast and their children now wanted to meet others with chronic illness. With over 30 plus members in my organization, over 1,000 followers on Instagram, and 36.7K likes on TikTok, we advocate for each other and others in our community. Take a Pain Check Foundation is a youth-led community founded in self-advocacy to empower others with rheumatic diseases. Alongside the bi-weekly podcast, members of our community, like yourselves, can get involved in our youth, young adult, or healthcare professional ambassador programs. We pilot rheumatic-related events. You can share your story on our blog platform, lead or participate in our monthly joint chat room hangouts to connect with those with other lived experiences that might be similar to yours. Not only that, we do have a monthly newsletter in which you can subscribe to get updates on everything that we do at the end of the month. What I realized over my journey is that I was indirectly raising awareness once I learned how to advocate for myself. I was educating people about how young people get arthritis by creating podcast episodes, sharing content on social media, and making more content as well as talking about it everywhere else. In the summer of 2021, I had the honor to be on New York Fashion Week virtual show for the Tumblr and Tipsy 2022 collection led by fashion designer Michael Kaluva, who lives with rheumatoid arthritis. I wore blue and purple to raise awareness about arthritis and chronic migraine. Along with the Canadian Arthritis Patient Alliance, we hosted a Navigating Self-Advocacy Instagram livestream event with several guests discussing how they learned to advocate for themselves. We currently are working on our newest project called Make Room for Youth to assess the needs of young people with rheumatic diseases. And with that in mind, we will create resources that will allow them to learn how to manage healthcare insurances, learn how to advocate for themselves, learn how to track symptoms, and more. We've also hosted with Creaky Joints and the Canadian Arthritis Patient Alliance a workplace and arthritis Twitter space event and how to advocate for your accommodations. I also got the opportunity to attend the American College of Rheumatology conference last year where I met Cheryl and many other arthritis advocates.
I'm looking for a yellow bone, long hair star, thick in the hips, come get in my car.
I have also aired 60 episodes on the Take a Pain Check podcast to date. I spoke about my arthritis on the Arthritis Life podcast hosted by Cheryl, the Sick Boy podcast, the Pain Waves podcast, and my Spoonie Sister podcast. Last fall, I was featured in my city newspaper, the York Region's Markham Economist, where I was interviewed to talk about my journey living with arthritis as a young person, as well as how I built the Take a Pain Check community. Navigating a chronic illness in itself is very difficult, let alone sharing it with your friends. Alongside the Canadian Broadcasting Corporation, a news media source in Canada, I created a documentary, If It Weren't for My Friends, I Wouldn't Have Survived, with the goal of spreading awareness about arthritis and creating a resource for those who are too afraid to talk about their chronic illness to their friends. The documentary shows how my friends and I learned about arthritis together and how we now raise awareness and advocate together. To end off my presentation, I would love to share my key tips for being your best advocate. I have 8 of them. Advocacy is a lifelong process. The skills that you learn along the way will stay with you at different stages of your life. Do your research, know what is available to you, and understand what your needs are. Speak up for yourself. By doing so, you are understanding your needs and helping other people understand them too. Seek support if you need it. There are multiple people and groups out there like Take a Pain Check and speakers in this conference who are here to guide you along the way. Have open and honest conversations. No one knows you better than you do. Be firm and persistent. It might not work the first time. Sometimes you just have to be the one who makes the most noise in the room to get what you need. I would like to thank Cheryl for this amazing opportunity to allow me to share my story and talk about my journey to advocacy. If you would like to connect with me and get involved with Take a Pain Check, feel free to scan the QR code on the screen and follow us on social media as well as reach out. I'm here to answer any questions that you may have about advocacy or arthritis in general. Thank you so much.